And welcome to Sugar Talk with Dr. K. Jane Lucas here from Diabetes and Endocrinology Consultants. Doctor, what are we talking about today?
We're talking about more drugs for diabetes.
Okay. And anything in specific? Any target here?
The drugs are affecting how the kidney works on the sugar. And most people don't think about the kidneys having anything to do with the blood sugar, although people do know that when their blood sugar is high, they tend to urinate more, they get thirstier, fluids are pulled from the body. So the
Well, it's
kidney,
also a symptom, right?
right, symptom of having high blood sugar. The kidney actually holds on to sugar, just like the kidneys are supposed to hold on to protein. It's supposed to hold on to anything that's important and get rid of waste products. So the kidney not only gets rid of waste products, but also holds on to things. So it holds on to sugar and protein.
Yeah, one of the concerns, I guess, people when they throw off proteins, right?
Right. So if your kidney starts leaking protein, then that means you have kidney damage, usually from the diabetes. But what we're talking about is sugar, because there's some glucose transporters in the kidney, and as the blood goes through and gets filtered by the kidney, the little glucose transporters hold on to the sugar and put it back in the blood. And people with diabetes apparently do this very well, and so they have a higher blood sugar because the kidneys are holding on to more sugar than normal. So what they've done is they've made medications that block the kidney from holding on to sugar. So not only does the kidney lose sugar when your sugar is really high, but even when your sugar is normal, you can lose some sugar out through your kidneys. And this pulls sugar out of your body, this pulls calories out of your body. So a lot of people like it because it helps them lose weight, it helps lower your blood pressure. So the types of medicines that are available that do this are helping other things besides just the diabetes. There's 3 of them. They all got approved about the same time. Invokana, Farxiga, and Jardiance.
Oh, well, we've seen all those advertised.
Yeah,
so
so
that's what
you know
it's
all
doing.
the side effects.
Yeah.
But they've actually come out really good. They were approved for type 2 diabetes. What's happening now is they're trying to get approved for type 1 diabetes, because type 1 diabetes does not make any insulin, but their kidneys still hold on to sugar. So it'd be nice to help them a little bit by giving them another medication in addition to insulin that would pull sugar out of their body.
So there are tests going on now, or there are experiments going on with that?
Yes, we have some research studies in our office actually that for type 1s as well as type 2 with this type of medication. So the medications, there's 3 approved, but there's like tons of them that are trying to get approved. And also there's some that not only affect the kidneys absorption of sugar, but the intestinal tract absorption of sugar. So we're doing a study with one of those medications that do both. So the dual one actually is very interesting also.
Okay, so are these, under these studies, are they different formulations from the ones that are already approved? Or?
Yes, the ones already approved just affect the kidneys. They don't affect anything else. The ones we're working on can affect the kidneys and the intestinal tract and prevent sugar from being absorbed both ways.
Okay, so maybe the question is, I don't know, is how many places in the body is sugar absorbed?
Well, it's not absorbed through your skin usually.
Okay.
And mainly it's absorbed in your mouth when you eat it.
Right.
And you turn it into sugar, or you eat starches and it turns into sugar. So what happens is it floats around, the cells take it up, they use it or store it, and then the remainder goes out to the kidneys to get filtered. And the kidneys don't like losing nutrients from the body, so the kidneys normally just hold on to sugar. So these medications prevent the kidneys from holding on to sugar. Now, if you don't hold on to sugar, what happens is you have sugar in your urine. So some of the common side effects would be urinating more frequently, depending on how high your sugar is. If your sugar is really high, you may urinate more because you'll have more sugar in there. You tend to get dehydrated if you don't keep up fluid intake. So you want to drink lots of water when you're taking these medications. You may even have to change your blood pressure medicine if you're on a diuretic. If you're on a fluid pill for your blood pressure, you may not need it as much or may not need it at all. So you have to keep an eye out for low blood pressure. So blood pressure would be if you felt dizzy when you stood up or lightheaded, felt like you're going to pass out, then your blood pressure may be too low on these medications. So that's another thing that I don't think people, I don't know if they're in the TV ads or not about the low blood pressure. A lot of other things are. But the main thing for them is that if you're on a bunch of medicines like a lot of people with diabetes are, you want to make sure that you need all those after you start one of these medicines, because you might not. Also, people that have sugar in their urine can get infections, mainly yeast infections or bladder infections. And men can get yeast infections too.
Right.
They think, oh, I don't get yeast infections. But yeah, they can because it's splattering sugar all over that area.
Right.
And you can grow yeast down there.
Okay, so could you also have too low a blood sugar as a result of some of these medicines?
No, you can take it even if you don't have diabetes. It's not going to do anything. So what they were even thinking about doing is using it in pre-diabetes, and we're getting a study for that pretty soon. So pre-diabetes is people that their blood sugar is a little bit elevated, but not totally. And if you got rid of the extra sugar before you got diabetes, you might not get diabetes. And so that's one possibility, one possible use for it. I don't think it's going to be a weight loss medicine just because it's not that great for weight loss, but it does help people with diabetes not have excursions in their sugar that, they go really high after eating. So it helps that, and it overall helps control the diabetes.
All right. Again, we're talking about these diabetes medicines or medicines that affect the kidneys as well. Are there other effects of the kidneys that we have to be aware of? Or?
Well, if you get dehydrated, the kidneys don't like to be dehydrated. The kidneys like to have plenty of fluid going through them. So one of the warnings is, if you start getting dehydrated or thirsty a lot or dizzy, then the kidneys could not work properly if you do that. So that's why you have to keep the fluids going.
I know that's one of the admonitions to older folks as well, but also folks with diabetes, is to drink more water. But often they find it difficult to consume.
Yeah, and
water.
you can drink any kind of water. You can drink flavored water as long as it doesn't have sugar in it. It's fine to drink it, and that keeps you hydrated.
So there's certain things to pay attention to there too, and we'll have more coming up in just a moment. And you mentioned about the tests and the different research studies that you have out there. Tell us a little bit more about what you have going on.
Right now we have several type 2 studies with oral agents and with injections. All of those medications tend to help you lose weight instead of gain weight like most medications do. And then we have 2 type 1 studies, and that's what we were talking about with those same type of agents that pull sugar out. So the type 1 studies will be very interesting for people to be on a different kind of medication rather than just insulin.
Okay, all right. And those studies, are these some of these really broad studies that thousands of people are in them?
Yes, usually they'll start off, phase 2 will be a lower number, maybe 200 or 300 people in the whole country, but the one study we had already finished is also going to do this with Jardiance with type 1 diabetes, is gearing up for a larger study. So they must have had some good results from their pilot studies. So our pilot studies are usually small amounts of people to sort of see if the drug really is going to work in that type. And so then they'll do a bigger study with more people. Like the second one will have over 900 people in it. To see if it's actually doing well with type 1. And the
studies that you do out of diabetes and endocrinology are mostly a certain type, right? I mean, there's a certain stage of study?
Usually it's phase 2 or 3. And phase 1 is just on healthy volunteers, and we don't do those kind. But we do after they've figured out the study is safe, or the drug is safe, then we'll do phase 2, which will be determining the correct dose, and then phase 3, which will be comparing it as a treatment for diabetes. And usually there are diabetes studies. We had a lipid study. We get other types of studies at times, but right now we just have diabetes studies.
And do you see very promising things coming out of these studies in the years to come too?
Yeah, I mean, type 2 diabetes has about 300 genetic defects, so they're still working on all the different things that could help. And so there's lots of different medications. There's combinations of different medicines that help, and everybody's a little bit different. They're on their own experiment.
Right. But are more and more diabetics taking a combination instead of just
Yeah, and I think that's wise. It depends on when you get started with medication. If you get started really early, maybe just metformin would be okay. But since there's so many genetic defects, most people have more than one, causing the blood sugar to be up. So that usually means at least 2 medicines.
And of course, Diabetes School, your next one's coming up less than a month now.
Right.
October 15th at the North Carolina Aquarium in Pine Knoll Shores. You can find out more information about that. Sign up too. Go to beachdoctor.com or give them a call at 252-222-5700 for diabetes and endocrinology consultants. And we'll see you next week.
Okay, thanks.